breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, Dr. Glenn Harrison.
Hey, Dr. Kolby.
Buddy? You like the new digs? Look at this. I finally got it done. Finally got the basement done. You've been hearing me talk about it for
antlers.
weeks.
There's even antlers in there.
Right there, buddy. Not from that's from a living animal. I'm sure that one's still living. Those ones were picked up off the ground.
Nice. Very, very good.
So today we are talking about something that we get in our offices quite a bit, which would be bursitis. And today we're going to break down what it is, what the pathophysiology of it, and what are some strategies that you can implement in your day-to-day life to help you maybe take care of that. If this is your first time listening or tuning into the podcast and you like the information, please hit like and subscribe, share it with your friends, family members, or loved ones, or anyone that you feel might get benefit from this information, because we're going to keep rolling out new episodes every week, and we might be covering something that's beneficial to you. So without further ado, buddy, let's get rolling.
Yes, bursitis. This is one thing that we came up with this. We're like, we should talk about bursitis. And it was kind of like, whoa, we should. And because it affects so many people, and it's a lot of times it's not even diagnosed, and people just suffer, and they have nothing. They have no clue what's going on. They can't walk. They can't ride in a car. Just can't sleep. It's absolutely terrible. So I'll let you start off of why is it important, other than kind of what I said.
Yeah, so let's just start out with what a bursa is, right? So a bursa is a fluid-filled sac that are kind of in a couple of key points in your body that actually provide a point of lubrication or a buffer between like tendons and bony prominences on your long bones or in your shoulder, for instance. Like there's one in your hip. And basically what it does is it prevents you from fraying really important stuff as far as, ligaments and tendons for stability. What happens when you get bursitis is that fluid-filled sac actually becomes compressed, and it's really, really sensitive to compressile forces, and it's really, really densely innervated with pain fibers. So when it's compressed for long periods of time, it becomes incredibly painful. And that's just really, a sign of something that's kind of like more largely going on, which could be like some changes in muscular tone where you have some tightness. It could be chronic injury. It could be lack of stability. There's a whole bunch of other underlying factors that can be causing the bursitis. But ultimately, that's what it is it's inflammation of that tiny little fluid-filled sac that's providing lubrication. Yeah,
that's really what it is. Bursa is the sac of fluid, and it acts as a cushion. You've put it a lot more articulately, but just a cushion between tendons, mostly tendons and bones. So you don't want your tendons to be rubbing over bones all by itself, because it'll fray like a rope and create havoc. So this bursa bursas are normal, but bursitis, as we always learn, itis is really inflammation. So it's the irritation of the bursa. So what happens when someone has bursitis? How does it affect them, and what are they going to experience?
Sure. So it's going to be hot, right? Mm-hmm. Obviously, inflammation is hot. Then you look at it, it's also going to cause a lot of like really focal pain. Like a lot of patients that come in with bursitis are like, oh my gosh, it hurts right here on my hip. It hurts right here in my shoulder. And really it causes a lot of discomfort. Like you can't sleep on your side. You can't, have anything with direct contact that's going to compress it at all.
Just touching it. If it gets that bad, just touching it, it'll irritate it.
I can't maintain my normal activities during my day. I can't exercise anymore because it's really painful. So it really is. It's going to limit your mobility. It's really sensitive to pressure or touch. And it can dramatically affect your sleep patterns. People who have a lot of bursitis, especially in like their hips and their side sleepers, just going to be totally devastating to them because they can't get comfortable, right?
So where do you usually see it? I know it in clinic where I see it. I'm not working with musculoskeletal pain, but usually where I see it is the outer side of the hip. Mm-hmm. We call it trochanteric area, the trochanteric bursa. And where else do you see it?
Yeah, so the most common I would say would be the trochanteric bursitis, or that pain on the outside of your leg like you talked about. But then I also see it in the shoulder. You can get it sometimes in the elbow, but I'd say the most common is probably the trochanteric bursitis or the hip
Yeah.
bursitis and the shoulder bursitis for sure.
Yeah. I have seen it in the knees. In fact, I've even experienced it years ago when I used to do a lot of mechanic work as a kid, and I was always kneeling on hard surfaces, concrete, and my knees would ache, and it wasn't a musculoskeletal thing. It was a very focal point tenderness, just like you're saying. And it was probably just too much pressure on the bursa, that cushion, if you will. So that's maybe some. So if anybody's listening to this, so they probably like, okay, maybe this is what I'm dealing with right now. It fits, and so what can other than it being focal, maybe some heat. That's how it's going to bother them, sitting, laying in certain positions. It affects walking. What are some of the mechanisms, the causes of this?
Yeah,
You did talk about tight muscles, but if we can get a little deeper into it.
sure. When I look at especially bursitis in the hip or the trochanteric bursitis, I look at it as there is like a fascial band and a group of muscles that runs over top of it called your iliotibial band and your tensor fasciae lata. And when you get chronic tightness of that, it literally just compresses that thing down, and it can be really, really, really painful.
So you're talking on the side of the leg, right?
Yep,
right over that bursa, over the cushion, over the cushion, the bursa.
And this one's really, really easy to diagnose because you can use really simple orthopedic tests. You know, there's a orthopedic test where you push on the bursa and then you move the leg in certain directions. It's like, yep, that hurts, and it's not so bad there. And that can really be indicative of bursitis, because it's when that bursa slides up underneath your finger, it's going to hurt a lot more than when it slides away from your finger, right?
That's
So when I look at stuff like this, it can just be chronic tightness. It can be some instability in the lower extremity where they're getting like compensatory mechanisms where the muscles are trying to like hold things in place that are unstable, provide a little shunt stability there. I mean, basically what you have to look to, it's either direct injury, right?
Yeah, impact.
So something like kneeling on it, right? Like you were talking about. Yeah. Or taking a helmet to the hip or something during a football game, that could cause some bursitis. It's got to either be a direct injury, or it has got to be some sort of underlying condition like tightness, or it could be like arthritis if it was in the shoulder or something like that. So that's when you have to just do the orthopedic tests and then get some imaging if it's inconclusive.
Yeah. So, when I seen most of that kind of that hip bursitis, if we're going to focus on that, but there are those other areas, that tightness, whether it's imbalances in musculature from the inside of the leg to the outside of the leg. I see this a lot with runners getting bursitis on the outside of the leg because those IT bands and the TFL on the side, tensor fasciae lata, get really, really tight, putting pressure on the bursa. So the bursa is never the problem. The bursa is just a symptom of some trauma or some muscle tightness or imbalance of musculature on one side or another. Now, I know you do a lot of chiropractic in the office. I've seen where there's pelvic dysfunctions, right? Ilium dysfunctions. Tell us a little bit about that and what people would experience, and then how a pelvis misalignment, if we want to call it that, play into bursitis.
Sure. I mean, if you have aberrancies in the way that your hips are functioning, right, or your pelvis, we'll just say pelvis in general, right? Your pelvis is functioning. It's actually going to alter the Q angle, is what they call it. So it's actually going to alter the way that the angle at which the hips come out of the ilium or the pelvis, and then it's going to alter the angle of the knee, right? So if you look at it and you have like chronic aberrancies in the pelvis and it alters that strike angle or the Q angle of the hips and the knee and everything else, then it's going to put a little bit more stress over those points that are providing that lubricating point. So then, like I said, those bursts are really densely innervated in pain fibers. So if it's chronically compressed, it's going to start hurting.
Yeah, and it's probably densely populated with nerve fibers as a warning system. These muscles are too tight, back off, right?
Yeah, that would make sense, right?
The nerves are there for a reason. It's just a warning system. So we touched a little bit on chiropractic, and you're doing musculoskeletal work, so I'm going to let you spearhead this. What are what are some natural strategies for these causes of bursitis?
Sure. So obviously making sure that it's bursitis is number one, right? And then looking at the underlying mechanisms would be number two. But then if it is true bursitis and you're looking for options as far as like management, doing things like ultrasound, doing things like foam rolling, myofascial release, massage, some targeted stretching with like some post-isometric relaxation stretches, massage. You can do natural anti-inflammatories, thing that we've talked about in previous podcasts, things like bioflavonoids, like, resveratrol or turmeric. You can do some topical stuff, has been beneficial in some cases where you do like some topical analgesics. You can do yoga, that's another option for a lot of my patients. Those are kind of the structural components to it. You can also do things like injections in some cases where they'll do like a localized injection of cortisone. They can give you some steroids. That's pretty much all I got. What about you?
Yeah,
Am I missing anything?
No, I think you covered all the bases. I think the most important thing, if someone's listening to this podcast and they kind of think it might, or hopefully maybe they've been diagnosed with bursitis and then they're looking for some strategies, or maybe they've got this thing going on, and hopefully it can give more clarity of maybe, dialing in that's really what it is. But I think the most important thing is, like you said, make sure it is bursitis. Bursitis is very easy to diagnose with proper orthopedic tests, whether that's a physical therapist or even MDs, DCs, chiros. They'll be able to determine if it's bursitis. And then hopefully the provider isn't just going to say, oh, yeah, it's bursitis. That's
bursitis. See you later.
That's that's the spot. But actually looking at not the bursa is the problem, but the structure that's putting pressure on the bursa. Some musculature or tendon that's putting pressure, and then asking, why is that tendon or muscle tight?
Right. Or taking a really thorough history. If someone walks into my office and they're, a high level athlete and they got checked or they got hit or something like that, they're like, yeah, I took a helmet to right here. Okay, that's probably the mechanism of the injury, right? But if it's gradual, if it's not a sudden onset or something like that, that's when you have to do the thorough history, the thorough exam, and kind of figure out what's causing the symptoms, the underlying cause.
Exactly. Otherwise, you'll end up taking injections for the rest of your life and not know why, or going for massage therapy every other day for the rest of your life, and you get temporary relief. But I guess for anybody listening, anything that I've ever had to do with bursitis, if it's done right, you can get rid of it. You can get rid of it, and there should be no trauma or problems after, and you can get mobile and get proper sleep, and it doesn't have to be this horrific experience, if you will. Mm-hmm.
Yep, absolutely.
Yeah, so I don't think I have anything else. I know I could always talk about diet, and we could always talk about diet that add to musculo tightness.
Mm-hmm.
But
or they could just listen to our other podcasts.
Yes,
we've already done a bunch of those.
Quite a few on those. So dive into the other podcasts when we talk about musculoskeletal pain and anti-inflammatory diets, because if you're eating the right food, it's going to improve any musculoskeletal condition. Be very confident with that. Yeah.
My one clinical tidbit that I would recommend to anyone that's suffering from bursitis is because most people are going to go home and Google it or YouTube it, right?
Yeah.
Never roll directly over the bursa.
That's right. That's
like
a little pocket of fire there.
Yeah. Never go directly over it, because you're just going to irritate the heck out of it.
And that's not the place where the original problem is, the cause of the problem. That's just the little entity, the bursa, that's got really mad. So go on the other ends of the bursa from the muscle.
Work your way to the bursa. Work your way from the outside in.
Exactly. Well, I think that's all I have for this one.
Yeah.
Do you have anything else to add?
No. If you guys like this video cast or this podcast, you enjoy listening, you feel like you got value out of it, obviously, like we talked about previously, hit like and subscribe, share it with your friends, family members, or loved one. And if you'd like to get a hold of us, our contact information is info@brainstormingwiththedocs.com. You can get it on our websites. Mine is www.northlakescheropractic.com. Dr. Glenn's is www.drgharrison.com. That thing is chock full of information. Great resource for a lot of you guys. And stay tuned, because we're going to continue to roll out new content, and you never know, might be your condition next.
That's right. All right. Well, it's great talking to you, Dr. Kolby. I look forward to the next one.
All right, buddy. Next time.